session will be on differential leukocyte count, as students may have joined after that. And if somebody has joined after estimation of hemoglobin and blood groups, we'll see what we can do about that. Today, let's have a session on DLC, and it will not be possible in the same session that some people will ask for, I'll do DLC, I'll do blood groups. Even in revision classes, if we get time after the syllabus has been done, even in revision classes, that cannot be done. That is not possible. That is not practically feasible. So you have to do one session one day, and you have to attend on that. On that day, you have to attend which you require. Some classes are held even after the last internal assessment, where those are optional classes. So optional, you may attend if you like, if you have need to revise, but you can't say what that means. That is not for the students to dictate what will be done. That will be decided by the department, the HOD of the department. So if you like, you can attend that session. Those are for, I'm talking about optional sessions. Here also, today's session will be on DLC as per the directive of the HOD, because the department knows that some people have joined later, but you have not attended due to any other reason, there has to be a written application to the HOD about that. So let's do DLC today. If you don't know, you know how to stain. So you don't know anything about staining of a blood smear. So you have to just learn that today. It is very difficult to achieve. That means make a good smear and stain it, and then do DLC in a single session. But at least you have joined late. At least learn something about it today. Let's proceed to the lab. So lab coats should have been ready by now. Classes are going on for almost 2 months. So you have to use lab coats, and what was explained that you will understand better when you do it. So blood is collected basically from capillary blood is collected, not venous blood. Venous blood may not be supplied to you during the exam. Venous blood means blood already drawn and kept, anticoagulated blood stored, or just drawn and anticoagulated blood is being. So you have to prick your own finger and take blood. So you have to learn that also. So for today, you may just work with volunteer কাউকে নিয়ে নাও blood আছে তো আছে হ্যাঁ ল্যান্সেটে করা তো উচিত you should especially who don't know, but what will happen is that she is attending for the first time. So you are attending this session for the first time. So what will happen if you now just want to prick and do, then it will require time, and this class can't be repeated now as of now. This is so you won't learn the other steps. So it will take time to just prick, and you are pricking for the first time. So lancet should be supplied, and the rest who have done earlier, they should prick and do, because this is to be what is to be done during the exam. For them, I'll just suggest, you can obviously prick and do, but do with the collected blood collected already, so that you can get acquainted with the other steps today, including counting of cells. Okay, during the exam that's 1 hour, but in the first session you would require some more effort from your side. ল্যান্সেট ওদেরকে দিয়ে দাও, আর কেউ ওদের মধ্যেই কেউ ভলান্টিয়ার করুক, তাহলে ব্লাড নিয়ে করুক। তারপর প্রিকিং, ইউ হ্যাভ টু লার্ন হাউ টু প্রিক, অ্যান্ড দ্যাট ক্যান বি প্র্যাকটিসড অ্যাট home also. You have to keep your own needles for that. If you can keep 2 slides, simple things like slides and needles, you can practice at home also. You can't do the counting, obviously it's not possible to have a microscope at home, but these simple things like slides, needles, and as you are relatively joined late for clinical physiology, measuring tape, these things I always suggest that keep your own personal things, so that you can use and practice clinical physiology you will have to also to practice at home, means home, hostel, wherever you live. So keep simple things like slides, needles, measuring tapes, stethoscope. These things you should have as a medical student. I hope both of you don't have any previous, that means any ailment related to some blood clotting issue or all. Nothing? Okay. So she will just draw a little amount of blood from you and you work with that. But during the exam, you have to work with your own blood. If it is written in the question your own blood, you have to prick your own finger. So then the spreader edge is first placed in front of the blood drop, or from this side behind the blood drop. So it is from being shown from your side. So as madam is an expert, she pulled it. What you do it is being shown from your side. You understand? You push it. So what was done? The spreader end, it was drawn onto the blood from, you notice the shape. So ideally a blood smear is a tongue shaped smear. As beginners, it will be difficult, maybe difficult for you. প্রিক যদি প্র্যাকটিস না করো তাহলে কোনোদিন পরীক্ষার দিন গিয়েও 1 বছর পরেও হবে না, যা করবে না সেটা তো হবে না। Allow the blood to spread first. Yes, now one single stroke, almost okay. And first time it will not be as good as she did, that is still okay. Ideally it should be tongue shaped and the length should be almost covering 2/3 of the slide, but still you can work with it. This is not 2/3 of the slide, this is maybe 1/3. This is a thin smear with a lot of gaps. You are also doing it for the first time?